Welcome to the Salmon Runs YouTube. Enjoy the video.
You start by checking power and cuff condition, because an underpowered unit gives wrong numbers. Once done, roll up a sleeve and place the cuff 1-2 cm above the elbow crease, aligning the artery mark with the brachial artery. Make sure it's snug but not tight. Sit upright with feet flat, back supported, and rest quietly for 5 minutes. This reduces noise from recent activity. You're now ready to begin the automated measurement sequence. Do not talk or move. You press the start button, the cuff auto-inflates, and the device measures oscillometric signals to calculate systolic, diastolic, and pulse. While it runs, remain perfectly still and silent. Movement or talking alters readings, so keep your arm relaxed at heart level. Once the device displays values, note systolic over diastolic and pulse. The monitor may show an averaging or memory icon. If the cuff shows an error or artifact, pause for 1 to 2. You finish by saving or writing down the reading along with date and time. Many monitors store multiple measurements automatically, so check memory if unsure. Then gently deflate and remove the cuff, wipe it with a damp cloth, avoid soaking, and store the unit in a dry, cool place. If values look inconsistent, troubleshoot. Verify correct cuff size and placement, replace low batteries or use mains adapter, and repeat the measurement after 5 minutes. This fixes most common errors and gives reliable results.
Thanks for watching. Consider subscribing if we helped you.